citizens service. And thank you for coming along to our workshop on emotionally based school avoidance. And we'll be sharing some of the work we've completed in this area over the last couple of years. The work started in 2018, so before the start of the pandemic, but the pandemic has meant that some schools are facing these challenges. More schools, I should say. This is just an overview of our presentation, and you'll see we'll cover a working definition of EBSA, how to identify children who may be more at risk of developing EBSA, and then factors that maintain their difficulties in attending school. We will then cover what schools can do to address these difficulties. To give you a little bit of background to our work on EBSA, as I said, this began in 2018, and this was a service-led piece of work in response to this being an area of difficulty that was being raised by schools that we worked in. Our work started firstly on developing tools for EPs to use in their casework, such as information gathering tools which would help the EP identify what factors were contributing to the difficulties the child was facing in attending school. We then changed our focus to developing tools for schools, and this included information leaflets for parents and carers and a series of bite-sized videos schools could share with staff. The aim was to produce freely available tools which schools could use to raise awareness of EBSA in their schools, and then identifying what action their staff could take. We also developed our directory, which helps schools know which teams are available within Oxfordshire to support their staff when there are EBSA concerns. What is EBSA? EBSA is a broad umbrella term used to describe a group of children or young people who have a significant difficulty attending school due to emotional factors. It also includes those that show sporadic attendance or still attend school but have emotional reactions to certain lessons or activities. This group is less obvious and therefore harder to pinpoint, that are often the ones that we need to support early to avoid their attendance becoming an issue later on. EBSA also includes children who may struggle to leave home, have stomach aches and feel sick. Certainly that often happens on a Sunday evening. And for these children, once they're in school, they often recover quickly, and then we can all question the validity of EBSA. However, their anxiety was real for them, and we must remember that the anxiety was there and that could occur again and again and become worse unless support is offered. It also includes those whose attendance patterns and physical symptoms are rarely common, but what is shared by all children who experience EBSA is that they all have anxiety. Some will communicate this verbally, and some will show this through their behavioural responses, such as oppositional responses, or through physical symptoms, headaches, feeling sick, stomach pains. And we need to tune in to individual people and what they're trying to communicate to us all, as it will vary from child to child. It's really difficult to estimate exactly the prevalence of EBSA. It's likely to be higher than 2%, as there are many children with EBSA. Many episodes of EBSA are not recorded. For example, those children who may be educated at home. And we also know that COVID obviously has had a huge impact on the COVID numbers, but as yet there's no firm data available on this. But what we do know is that EBSA occurs in both primary and secondary schools, and slightly higher in secondary schools, and it's equally common in males and females, and there is little evidence of a socio-economic link. The impact of EBSA is far-reaching and includes poor academic attainment, limited employment outcomes, and poor mental health as adults. There's also a link between these young people having children later on who also go on to experience difficulties attending school, and so the cycle continues. Lost a slide.
Yeah, I think you skipped a slide, Deb.
Ah, there we go. Sorry. So the role of an educational psychologist. What do we bring to this work? So EPs work with both research-based evidence and practice-based evidence. And we can review and apply the research and adapt this based on the context of need of the child, the family, and the school. We have a strong understanding of theory and research in a wide range of areas, including communication, cognition and learning, social, emotional and mental health, and physical and sensory needs. So this really provides us with a really holistic view of the child, which is really important when we're trying to address COVID concerns. In our work, we don't view a child in isolation, as many professionals today don't. We always view the child within a context, and we always try to understand the complex range of factors that are interacting with each other. EPs also work directly in schools, so we can work from an early intervention perspective. We know that acting early is really important to avoid the issues becoming entrenched. We're hands-on, so we can observe the impact of COVID. We go into schools on a weekly basis, and we can bring a strategic view to a whole school setting if the problem of EBSA is becoming wide-ranging. What we do know in terms of EBSA is that the three blue boxes are really important in terms of addressing attendance concerns. And Ali will go on to those later on, and Jess, when we're looking at interventions in school. So agency and control, we all need to have a sense of control of the things that we are involved in and have a sense of hope. Relationships is really important. Having connections with people, a sense of belonging so that you feel safe and secure. And at a whole school level, how schools can do that for all pupils who attend the school and bring that sense of calm. And also practical support. So what adaptations can schools make to address these concerns? I just want to touch on EBSA and pandemic. So obviously the pandemic wasn't around when we first started the work, but I think it's really helpful for us to just touch on how it's still causing anxiety for those that are experiencing EBSA, because it continues to destabilize children. So just touching on some of those, that staff absence, the adults who usually support young people in the classroom may not be there. And for those who have special educational needs, we know that's going to be even more of a relevant issue for them. Friendships, we know we're coming out of the pandemic to some extent now, but there have been huge periods of time where children were on different periods of isolation. And the periods of isolation also meant that there were breaks to the normal routine that children had. And we know that some children find that really difficult to adjust to changes in routines. It's becoming less of an issue, but there were huge changes to the normal routine of the school day. Trips were different, playtimes were different, staggered starts were different. They were coming and going at different times. We've also got new digital habits, and there have been changes in the use of technology, and how we connect with peers, or how children were connecting with peers has changed. And so for some children, that has meant they have become more socially isolated. There's still ongoing uncertainty, particularly for those who are going to be sitting in public exams for the first time in 2 years. So, and also all year groups may be concerned about gaps in knowledge. COVID also meant that families were making different choices about attending school. They might have kept their child off school if there was an important family event that was coming up or a holiday. And so they possibly kept their child off school when beforehand they wouldn't. And equally, schools might be making different decisions. So they might be erring on the side of caution and sending children home that were presenting as unwell when possibly they may not have done that in the past. In terms of a working definition, I'm not going to read this out. I'll just give you a couple of seconds to read that. And I think the thing that I would like to note is that there is a clear distinction needs to be made between those that are absent from school due to their behaviour choice and those that are absent from school due to the specific emotional distress that they may experience around attending school. I'm now going to hand over to Ali.
Thank you, Deb. So we're going to have a think now a little bit more about some of the possible causes for EBSA. So on this screen is the anxiety cycle, which shows how a negative cycle can be created around EBSA. So if we just start at the top and look at the outer circle. So a child or young person may feel anxious about school due to a number of reasons. So it could be that they're struggling to keep up with their learning and understanding their lessons. Perhaps they're being bullied, or maybe they don't want to leave home. Possibly one of their parents is ill, for example. So they're feeling anxious. They've got these thoughts kind of whirling around in their head more and more, and they'll be looking for evidence to support those thoughts. And they might not have any strategies or limited strategies to manage their feelings of anxiety. And so the only thing that they think of to do is to avoid that situation altogether, in this case, by avoiding school. And this provides temporary relief, but those feelings are still there. And because they're never addressed, they just grow and grow, which leads to more school avoidance behaviours. So that's the outer circle. And then on top of this, if we have a look at that inner circle, we can see what happens is you have these secondary factors that start to come into play, and these can maintain EBSA. So, for example, they might miss out on social events, they might miss more learning and then be worrying about having to catch up. Maybe at home they're doing things that they enjoy, so perhaps they're able to play games at home, or they're spending more time with family. So we know that anxiety plays a significant role in EBSA, but we can also see from that inner circle there's a lot more behind it, and there's often a really complex interplay of factors which are all going on. Can you go on to the next slide, please, Deb? Okay, so here is a definition of EBSA. So EBSA occurs when stress exceeds support, when risks are greater than resilience, and when pull factors that promote school non-attendance overcome the push factors that encourage attendance. And in just a moment, I'll talk through a little bit more about resilience factors and the push and pull factors. So here we can see how risk factors can be summarised into three main areas. So there's school factors, pupil factors, and home factors. And the circles overlap to demonstrate that multiple risk factors from a range of sources are likely. So some examples of school factors might include feeling anxious about their academic studies, exams, maybe worrying about peer relationships in school. Maybe they've got specific lessons that they're trying to avoid. So PE is quite often a big one. Or maybe there's certain transition points in a school day. Then home factors might include something around like the family. So there might be a parent which is unwell. They might have had a bereavement in the family. There could be all sorts of stress happening at home. And also if there's a family history of mental health difficulties or of EBSA, then that's more likely to be a risk factor for a young person. And then the pupil factors, they might have had a particular traumatic event which is making them anxious. They may be feeling anxious about being separated from family. Age is a factor. So the evidence kind of suggests that there's key points such as sort of starting secondary school is a big point where you might be more likely to have EBSA. There's evidence out there to suggest that if you've got special educational needs or a disability, then you might be more likely to have EBSA, general physical illness, and history of school avoidance as well. So those are just some of the risk factors. And usually there's a triggering event that will lead to EBSA starting. So, for example, that might be a bullying incident or a parent becoming unwell. So It's worth just noting that EBSA can either be quite a sudden thing that happens. For example, if a parent gets a diagnosis or needs to have surgery, or it could be quite a gradual thing that happens. So it's important for schools just to be aware of that, and it's not always easy to see those triggers. Okay, so on this slide within maintenance factors, we're looking at the inner circle that we saw with the anxiety cycle earlier on. So these are those secondary factors which keep EBSA going. So these maintenance factors keep that seesaw in favour of school avoidance, and the pull towards home becomes stronger. So in this example, we can see a decrease in motivation to attend school. That leads to falling behind on schoolwork. That then leads to a feeling of losing friendships and increased isolation. And then this leads to increased anxiety around school, followed by the pupil finding more pleasurable activities to do at home. And that cycle just continues in a loop where motivation to go to school is further decreased. These maintenance factors are quite a good place to start when looking at where to focus an intervention. So, for example, if a maintenance factor is that they're worrying about being behind in their schoolwork, then an intervention could be put in place to address that. Or if they're feeling isolated from their friends, then maybe an intervention could look at kind of increasing social interactions with their friends. Okay, so we're just going to have a look at the push and pull factors in a bit more detail next. Okay, so these are the push factors. So a push factor is something about the school environment that is disliked, that pushes that young person away from wanting to attend. And the review of the literature indicates that there are 4 main reasons for school avoidance. 2 of those are push factors and 2 of those are pull factors. So on this slide, we can see the first 2 main reasons for EBSA occurring. So the first one is that to avoid uncomfortable feelings brought on by attending school, such as feelings of anxiety or low mood. And the second reason would be to avoid situations that might be stressful, such as academic demands, social pressures, and aspects of the school environment. So those are things that are pushing that young person to avoid school. And on this slide, we can see the pull factors. So this can make up the 3rd and 4th main reasons for school avoidance. So we've got to reduce separation anxiety or to gain attention from significant others, such as parents or other family members, and to pursue tangible reinforcers outside of school, such as going shopping or playing computer games during school time. So these pull factors are related to elements of home life or community life that appeal to and reassure the young person. So these pull factors positively reinforce EBSA, whereas the push factors negatively reinforce EBSA. But it's really important to have a think about the possible protective factors as well. So there'll always be protective or resilience factors for a young person. And once identified, they can build areas of strength or resilience for the child, the family and the school, which might help to protect the child and to help promote school attendance. So building on these might include supporting their social skills, setting up friendship groups, or making sure they've got a trusted adult in school that they meet with, maybe encouraging them to have hobbies or interests outside of school. And you might look at setting those up in school first, or kind of increasing positive phone calls home. So it's really kind of working out what are those resilience factors for that young person, and then how can you help to boost that even more. Okay. And this is one of the documents that Oxfordshire have put together. So it just brings all of the push and pull factors all into one place, which is just quite helpful to have a think about what is pushing and pulling that young person kind of either to or from school and home. So I'm going to hand over to Jess now, who's going to talk a bit more about interventions.
Thanks, Ali. So we've heard how push and pull factors and protective factors can affect a young person's capacity to attend school regularly. And a familiar framework for intervention in schools is this graduated approach. And we can use this graduated approach to think about EBSA as well. So for a school, it's important for them to consider their universal offer, their universal provision. That's the provision that's available for all students. And they can think about how their universal offer can help prevent EBSA in the first place, or support students showing those early signs of emotional distress or anxiety about school. And that might include things like the school's policies and their systems, the systems that promote well-being across the whole school, and the systems that help identify early signs of difficulty, early attendance difficulties, or early signs of emotional distress. Sorry, Deb, I'm still on that slide. So it's things like strategies that would help promote a sense of belonging in positive relationships. It might include the social emotional learning curriculum and school-based mental health support. It could include transition or bridging or orientation packages. A lot of secondary schools have those in place for children starting in Year 7, for example. And it might include things like parental involvement initiatives. So those are the universal sort of level. At the targeted provision level, you're thinking about schools having a targeted provision which would help identify early signs and concerns around attendance or school engagement. So some children, maybe they're not attending, they're coming into school, but maybe they're not making it into every lesson. So if you pick up on that early and provide support early, maybe you could prevent sort of more longer term and more entrenched EBSA type difficulties in the future. So that might include having a link person who's coordinating the school's approach and linking with family, and they need to be linked in with that attendance data. It would include looking at attendance problems and other signs of emerging distress or obstacles to attendance. And it would be important to kind of rule out at that early level any issues related to things like bullying. So they need to be, there needs to be a good anti-bullying policy and anti-bullying structures in place in the school. It might also include support at difficult times of the day. So the beginning of the school day, breaks and lunch times, and support from a key worker to reduce distress, teach coping strategies early on. And at a bespoke level, you're really talking about at the very top of the graduated response pyramid, very individualised and personalised provision that really fits a child's individual push and pull or risk and resilience factors. And that may include things like a bespoke timetable to support a return to school when a child has had a period of absence, but it will certainly involve gaining a detailed picture of the pupil and family views, and build on strengths and enabling the young person to feel in control by giving them options and a chance to input into their return to school plan. This provision may be quite slow and gradual at first before increasing the child's sort of level of attendance in classes. And it's really important at this level that the identification of additional needs, if they haven't previously been identified, is also sort of thought about. So if a child has got unidentified special educational needs or additional barriers to accessing the curriculum, they'll also need support for that. So that needs to be identified in this kind of bespoke level. Thanks, Deb. We can go to the next one. So what we've learned is that there are kind of 6 broad areas that we need to look at when designing interventions or support packages. We need to be thinking about supporting children with anxiety. So it might be around the emotional literacy provision in a school, or mental health support, or kind of coping strategies work. It's thinking about how a school can flexibly address particular push and pull factors. what's pushing children away from school that we can change, or pulling them towards home that we can change. And again, the broader context and ethos of the school is going to be really important for that. You know, have children got positive relationships with staff? Is there a clear anti-bullying strategy so that children feel safe and secure in their school as a whole? We need to think about early intervention and identifying those risk factors early. So good communication and identifying children maybe coming into the school who've shown early signs of emotional distress or attendance difficulties, or who've got kind of some of those key risk factors like a bereavement, or caring responsibilities at home. It's really important that schools are able to kind of maintain links with home, and that home maintains links with schools, so that communication can continue, and so that children are less likely to be out of school for long periods of time. Parents often kind of want to sort of support their child, and if their child is experiencing a lot of distress, it's really feels like the right thing to do sometimes for parents to kind of keep their child at home. So they need to sort of feel that the school can keep their child safe and is able to put support in place so that they can have that trust and model that trust to send their child into school. So that kind of homeschool link's really important. And hearing the young person's voice as part of this is going to be really important. We need to think about an individual approach, what they feel is going on, what they would like to be addressed, so that it can be really, it's going to be more like to work, and that they feel kind of in control of the situation. Sometimes reintegration doesn't work because we haven't listened to the child's voice enough. And sometimes we need to listen not just to what they're saying, because sometimes they say what they think people want to hear, but we need to listen to what they're telling us through their behaviour as well. And we need to build up those strength and protective factors. So we need to think about who they've got friends with, who they've got positive staff relationships with, what subjects do they enjoy, what hobbies and interests do they have, and give them the opportunities to kind of build on those in school and have those recognised. Thanks, Deb. Next one. So in summary, kind of we're thinking about those three key elements: relationships with young people and with staff, so that people have a sense of connection, security, safety and calm. We need to think about agency and control, so the young person's voice, the family's voice, options, a chance to input and to tell people how it feels for them, and so that they can have hope for the future. And kind of those really practical things, communication support, clear policies and structures in place, flexibility, and adaptability, so that if things need to be quite bespoke, they can be, and children aren't just expected to go straight back into a full timetable. Next slide. So just again, this sort of summarises some of those universal level considerations. At the school level, we need to be thinking about, what does the curriculum tell us? What are the policies looking like, and do they think about promoting emotional well-being and attendance? Are staff getting access to training around mental health, for example? Do staff know who it is that's responsible for kind of monitoring emotional distress? Do we know if it's a mentor or the form tutor or the head of year? Is everybody clear who they can go to if they've got worries about a child? And having clear links with other agencies who can support, again, with broader developments around training or curriculum. We need sort of support in place for the pupils. So again, that they feel heard. There's an opportunity for them to kind of, say if there are any issues. This is particularly important, I think, in secondary school, where children see a huge range of staff and they're not necessarily taught by their form tutor at all. So it can be hard to pick up on emotional distress unless you're making time to kind of check in with those students. And there needs to be kind of really clear no tolerance approach to bullying, and an environment that makes children feel safe at school. And some of that will be around sort of inclusion, acceptance of difference, and ensuring that pupil voices are heard across the school, and having those clear relationships with home. That's been particularly difficult during COVID because parents have no longer been able to come in for face-to-face meetings a lot of the time. And so some of those informal support mechanisms and ways of getting to know staff haven't been so easily available. So schools need to be thinking about re-establishing those and thinking about how parents can say if they're worried about something. And how parents can gain support and communicate and be supported to support their child appropriately. Okay, we'll move on to the next one because I know we're coming to the end of our time. I think the next one was targeted support. So again, these are sort of things that are available for some students who've been identified with maybe particular issues. So it could be just the general clubs that schools have available, a breakfast club or a lunchtime club. And sometimes children with emotional distress will need encouraging to access those. But having structure during break times, having kind of good liaison around specific children that people are worried about is going to be important. Having kind of targeted interventions that might be around emotional literacy and coping strategies. It could be things like literacy interventions to ensure children aren't feeling sort of behind. So it could be a range of things. Regular check-ins and support for those higher risk pupils. So that might be around times of transition or around referrals to particular other agencies like mental health support teams or school counsellors. And again, ensuring that for those pupils who have been identified with vulnerability, we've got some support for parents and some regular communication with parents to help them support their child and kind of, access, access sort of a joint plan and thinking about what's working well and ensuring that that goes in the right direction rather than getting worse. And then at a bespoke level, again, it's very much important to kind of take each child as an individual and assess their individual push and pull factors. But at a school level, they need a kind of a way of doing this. So they need an integrated sort of plan, way of communicating it, a staff who's got the overall kind of coordination responsibility and systems that allow them to, evaluate how things are going. Is attendance improving? Is engagement improving? Have they come in today? Those sorts of things. And again, a higher level maybe of support for parents, regular meetings, maybe early help mechanisms, and thinking about other things that might support the people with attendance. That could be, making time for them to spend time with siblings or walking into school with siblings, or whatever it happens to help them. There's a lot of children in local schools who will have cousins and wider family networks within a large secondary school. So then I think our last sort of couple of slides was sort of signposting you to kind of sources of further information about EBSA if you're interested in finding out a bit more. So our website, the Educational Psychology Service website for Oxfordshire, has got some of the tools and leaflets that we've developed as part of this project on it. But there are other local authorities that have done quite a lot of work in this area as well that are worth taking a look at. So you can have a look at those there. So I think that's probably come to the end of our time. So I suppose what we wanted to invite you to consider was how can sort of wider local authority mechanisms and clinical commissioning groups and so on, collaborate and work successfully together in helping schools to reduce this group of students, this EBSA need that we're seeing.
I don't know if you can see the chat as well, Jess, as you've been talking. So it's probably helpful just to reflect on some of the comments there, which is around absolutely the engagement of parents. And I think that as professionals going into school, we would always advocate for, as someone has put here, that parents are the expert. Oh, absolutely. And I think that it is around educating and awareness raising in schools. I think that perhaps the difficulty with EBSA is that every child's situation is unique, and it's really taking the time to understand those factors, those push-pull factors that are impacting on the attendance for that young person, and absolutely talking to the individuals who know that child well, who are going to then support that return to school.
Absolutely.
There was just a comment here, school often won't listen, especially attendance. And in terms of the health aspect, and someone's reflected here that sometimes professionals can sign off individuals too quickly. So we have worked, I think one of the questions was, have we linked with health? So we have, within Oxfordshire, we have a hospital school, and we have linked with them, and they have our materials on their website. So again, it's that awareness raising with schools in terms of what steps they can take first to address the attendance, rather than individuals looking to sign that young person off, because we know for many individuals that will mean that their difficulties will become entrenched and quite chronic, and then it is really difficult to kind of address those. I don't know if anyone wants to come off mute, if I've picked up all those the main points kind of summarised from, there's quite a similar theme in the comments, so hopefully I've addressed some of those.
I'm just going to come on and say it was really useful and interesting to watch your presentation. I have to go because I'm about to deliver another workshop, but I really would have loved to have stayed for discussion. But yeah, I think a big one is around kind of that whole services not kind of talking to one another in school, not being able to be joined up enough with the local sort of CAMS teams and the likes, and having those conversations. Mine was the comment around NHS headed letters. In my experience, that was, you know, with the attendance welfare officer, you know, it wasn't really enough unless there was actual NHS letters, and having private sort of referrals and letters and things were was not kind of taken seriously and was not recognised. So I think
it's small changes, but I think certainly emotionally based school avoidance is terminology that we now see being used in Oxfordshire, and schools are using it rather than anything that's not particularly helpful. So there's definitely change in Oxfordshire, I would say.
Good. Let's hope it ripples through the rest of the country.
Good luck with your presentation.
Thank you
anyway.
very much. Cheers.
Thank
Bye-bye.
you. I think we've come to our time, haven't we, Joe?
Yeah, that's fine. We've just come to the end of the workshop. Thank you very much. It was a very useful and interesting workshop. So we're coming to the end now, and the attendees have got a little break now, but then we've got our second workshop coming soon on a different link. Thank you to everyone who's attended the workshop today.
Thanks, Joe. Thanks for
Thank you for the feedback on the chat as well. Okay, thank you. That's great.
Thank you very much.
Thanks a lot. Thanks.